my name is Crystal Patterson. I'm going to be doing the insulin video today on administering insulin to a patient. I have my patient with us, the gloves, the NPH insulin, the regular insulin, hand sanitizer for hand hygiene, gauze and alcohol swabs. This is my Sharps container, and then I have a 29 gauge needle, 29 gauge half-inch needle with 100 unit syringe for the insulin. I'm going to go ahead and verify my EHR with the doctor's orders that the patient was ordered 4 units of the regular insulin and 8 units of the NPH or intermediate insulin, totaling of 12 units. It looks like everything is okay. I am going to go ahead and go over the rights. The 6 rights: the right patient, the right dose, the right documentation, the right medication, the right route, and the right time. Everything seems to be in order, so I'm going to go ahead and I'm going to come into the patient's room. I'm going to knock on the door. The patient says it's okay to come in. I'm going to shut the door, provide patient privacy, introduce myself to the patient. Hi, my name is Crystal. I'm going to be your nurse today. The doctor's ordered you to have some insulin today. I'm going to go over everything, but first let me go ahead and ask you, what is your name and your date of birth, and can I look at your wristband to make sure we have the correct one? All right, everything seems to be in order. Are you allergic to any medication? No. Okay, that's great. Do you have any allergies to anything else? No. All right. We also had checked your blood glucose level right before I came, and it was at 160, which is perfect. We're going to go ahead and give you this medication at this time. You will be getting your breakfast about 30 minutes after we administer this. I'm going to have a nurse come in and just verify that it is correct, that the doctor's orders, the EHR, and them are all matched. If you come in, thank you so much. We are going to be giving 4 units of the regular insulin and 8 units of NPH, totaling of 12 units. You do see it's correct. Thank you so much for your time. Thank you for your help. Okay, at this time, I'm going to go ahead and I'm going to perform hand hygiene. And go ahead and start putting on my gloves. I'm going to be explaining what insulin is to you while I am going to be prepping it. So insulin is given to help regulate the glucose in your body. So we're giving you glucose, and it helps the cells expand to create energy for you. Some of the common side effects are hypoglycemia, which lowers your blood sugar, and the other one is hives, which is an allergic reaction to it. So the first thing we're going to do is I'm going to clean the vials with some alcohol swabs just to make sure there's no that they are completely clean. We're going to allow those to dry as I open up the needle. Again, it is a 29 gauge half-inch needle with a 100 unit syringe. I'm going to go ahead and pull it down to 8 in oxygen in the air, so I can go ahead and put that into the vial. Okay, drop that down, put it in the vial. We're just going to push it in. I'm not taking any medication out. Go ahead and pull this back down to 4. So put that in the regular vial. Just to let you know that when you give any kind of an injection, there could be a burning or stinging sensation along with it, but it should subside within a few minutes. Pull it down. There's a little bit of oxygen, little air bubbles in there. We're just going to click it, try to get them up to the top. Pull it down just a little bit more. Again, go ahead and push it up, get that off. Okay, go back up to the floor. Take that out. Show the camera that it is out for, and then go ahead and into the next one. And inverting it, not pushing it in, but pulling it down, so we can go all the way to 12. Don't think there's any oxygen bubbles in it. We are at 12, so let's go ahead and take that out. Show the camera we're at 12. And go ahead and do the one scoop method. Back onto it. Push it on so it's nice and tight. All right, and we'll go ahead and give the injection to the patient. If you have any adverse side effects, please let me know. I'm gonna go ahead and start cleaning up. And I'm gonna leave the patient in a comfort position, give them the call light that they can reach me at. I'm gonna go ahead and document my procedure with the rights that we had done, with the right patient, right medication, right dose, right time, right route, and the right documentation, and if there was any adverse side effects or the reactions to the medication. Thank you so much. I'm also going to thank the patient for allowing me to be their nurse today. Thank you so much. And please let me know if you have any questions. Thank you.